Unhealthy eating habits have contributed to a lot of health problems epidemic today. Health problems like diabetes, high blood pressure, osteoporosis, arthritis, cancer, health disease, and so on. The good news is, if you can control what goes into your mouth and your body, you will live your best. For what you put into your mouth determines how well or sick you live. You and I know that poor diet is associated with major health risks that causes illness and even death. So, by making smart food choices today can help you protect yourself from all these health problems. Our integrative nutrition health specialist, Miss Vetty Agala, aka Buffer, wants to see you living your best without any health issues. She made this known in her program showing every Sunday on Healthy Living with Buffer TV. She tells us how our food choice affects our health and how we feel today, tomorrow, and in the future. If you are opting for optimal health, from fighting free radicals to living your way into a healthy and beautiful body, here are some things you must do. Eat a nutritious, healthy, balanced diet every day. Practice your daily exercise and take your supplement, especially vitamin D, vitamin C, zinc, and chlorophyll to boost your immune system against free radicals that cause cancer and other diseases. Join us on this program every Sunday, 1:30 p.m. US time, 7:30 p.m. African time, and 6:30 p.m. United Kingdom time, where she educates on health and nutrition as well as features professionals from various fields to sensitize you on wellness. See you there.
Oh my goodness, this is awesome. It is awesome today because today is a beautiful day and we must rejoice and be glad in it. Good day, viewers. Thanks for joining us live on Healthy Living with Bofa. I'm Betsy Olayinka Akinlosotu, aka Bofa, bringing to you live information on health and wellness. Like I always say on this program, wellness is viewed beyond absence of illness and the healthy foods on your plate. Wellness is about living well in all areas of life. Wellness is known to be an individual pursuit. We all have self-responsibility for our own choices, behaviors, and lifestyles, but it is also significantly influenced by the physical, social, and cultural environment in which we all live. Wellness is associated with an active process of being aware and making choices that lead towards an outcome of optimum holistic health and well-being. Today, we have on the program a beautiful, incredible expert in public health service. She's going to be joining us shortly on this program today. But right now, at this moment, is Health Corner. Let's bring that on before we have our interview with expert. And I know you can't wait to have this. I'm also excited. I can't wait to see this beautiful woman coming on to teach us few things that we ignored in our community, especially in our homes, individually. And these are the cause of many health issues that we suffer for today. So I'm going to be bringing her after her talk.
Hello, ladies
and
gentlemen.
I want you to join me when she begins to purge out that information you and I need. So right now it's Health Corner, and when we return, it's interview with expert. We will be right back.
And welcome back to Healthy Living with Bofa channel. Last week we discussed ulcerative colitis. This week our topic is contagious infection. Now let's jump into it. What is a contagious infection? Contagious infections such as flu, colds, or strep throat spread from a person to person in several ways. One way is through direct physical contact, like touching or kissing a person who has the infection. Another way, when an infectious microbe travels through the air after someone nearby sneezes or coughs, much like the coronavirus. Causes of contagious infections. Infectious diseases can be caused by many pathogens, including bacteria, virus, fungi, and parasites that may cause illness and disease. For humans, transmission or pathogens may occur in a variety of ways, such as spreading from person to person by direct contact, as we mentioned earlier, water or foodborne illnesses, or aerosolization of infected particles in the environment and through insects, mostly specifically mosquitoes and ticks. Symptoms. Signs and symptoms vary depending on the organism causing the infection, but often include fever and fatigue. Mild infections may respond to rest and home remedies, while some life-threatening infections may need hospitalization. Many infectious diseases such as measles and chickenpox can be prevented by vaccine. General signs and symptoms common to a number of infectious diseases include: number 1, fever; number 2, diarrhea; number 3, fatigue; number 4, muscle aches; lastly, coughing. Now let's look at our treatments. If bacteria causes a disease, treatments with antibiotic usually kill the bacteria and ends the infection. Viral infections are usually treated with supportive therapies like rest and increased fluid intake. Sometimes people benefit from antiviral medications. Now let's look at our key takeaway. Number 1, flu, colds, or strep throats are contagious. They spread from person to person by direct contact, water or foodborne illness, and aerosolization of infected particles in the environment and through insects, known as mosquitoes and ticks. Also through the air after someone nearby sneezes or coughs. Second, most importantly, eating foods highly rich in antioxidants will prevent and fight any bacteria in your body system. That is all that we have for you this week. Remember, I love you, God loves you, and love yourself. See you next week.
Wow. This is awesome. I hope you all learned from this talk. And when it comes to contagious disease, infections, and which we're going to talk about today with our guest, because she specializes on infectious disease. Public health deal with infections around us, anything that has to do with environmental problem. So that's what she specializes on. And she's also a physician. So today, like I said, we have on the program a woman that has been doing wonderfully in our community. Our guest today is Dr. Vetty Agala. She said to me, Bofa, we must all share responsibility for preventing the spread of diseases, prolonging life, and more. But what I'm really concerned about is promoting physical and mental health, sanitation, personal hygiene, and control of infectious disease in our community. This is very important. This is the only way we can contain and reduce the spread of infection around us. So today, she will be educating us on this dimension. I present to you an amazing woman who her priority is making sure our environment is free from germs and any viral infection. Dr. Vetty obtained a Bachelor of Science at University of Port Harcourt, Masters in Public Health, at Imo State University and a PhD in view in health system management at University of Port Harcourt, all in Nigeria. She is a member of West African College of Physicians and Senior Registrar Department of Public Health, University of Port Harcourt Teaching Hospital. She is a supernumerary president doctor, Department of Community Medicine, University of Port Harcourt. Everything is in Port Harcourt, Imo State. Just follow me. Dr. Vetty is a medical officer, River State Hospitals Management Board. She is the head of operations, free medical care program, health financing, health insurance focal person, River State Ministry of Health. Dr. Agala is the president, Medical Women's Association of Nigeria, River State branch. She is coming on the program right now to talk more about especially the global public health crisis we are all facing at this time. Right now, we're going to take a break. After that, I'll bring to you live our guests on the program today. So bear with me while we go on break. And when we return, our guests will be on live.
All what we've been waiting for. There is this saying that you are what you eat. This is absolutely correct. See, eating right is when we get all the essential nutrients our body needs from the food we eat daily. And these are minerals, vitamins, fats, healthy carbs, proteins, and fiber. Question we should be asking ourselves is, have I been feeding my body with essential nutrients? Many people have been advised to stay away from certain food. Why? Because they are very high in carbohydrates. But the study shows that your body system needs carbohydrates, which we call energy food. What is important is to go for healthy carbohydrates. Now, you have just one food item that can supply your body system with all these nutrients. And this food is called turmeric gari, trademark as gari didun. Turmeric gari, developed by Ajogbe groups and made from gari, turmeric, coconut, lemongrass extract is the product of an effort to enrich the nutritional value of gari, and the nutrients you get from it includes healthy carbs, minerals, vitamins, fats, proteins, and fiber. So whether you are super healthy, have diabetes, high blood pressure, and other healthy related conditions, the nutrition advice is to go for turmeric gari. You can eat directly as snack, soak in water, or make and enjoy as swallow. I promise you, you will love turmeric gari. To have a sample, can reach out to Burge and Brewer Services, New York, United States at this phone number 34761-35485 for distributorship in the United States. Please contact Gito Terminal African Market at this phone number 929-283-2653. For Nigerian market, please contact Ajogbe Groups at 292 Muritala Mohammed Way, Alagomeji, Yaba, Lagos, or contact them on phone 070-5656-5659 or 081-337-2939. Turmeric gari, you will love it.
Hello, wow, welcome back. This is awesome. I told you that the woman we have on the program today is an amazing one. A woman that you all been waiting for. And I'm so waiting for her because I want to see this beautiful face. So, ladies and gentlemen, please join me in welcoming Dr. Vetty Agala on Healthy Living with Buffer. Dr. Vetty, you're welcome on the program.
Thank you very much. Good evening, everyone, or good afternoon, depending on where you are.
Just good day, everybody, because we have
Day,
different time
everybody.
zones. Just good day, everybody. But Dr. Vetty, I'm so happy, honored, and so excited to have you on the program today. And I've already
Thank you.
told the viewers who you are. But let's
Oh,
know you more than what I said. And that's the reason why we are on the program today. And this first question will reveal to us who you are in this public health field. Can you tell us what does it take to qualify and practice as a public health physician?
thank you very much, Bofra. So public health is public health, and it means the science of protecting and improving health, of prolonging life of the people. So it's not an individual thing, it's something about the community. And then as a physician, it means you have a background medical degree. So I am a doctor primarily with a Bachelor of Medicine and a Bachelor of Surgery degree. And then I have gone ahead to specialize in public health, meaning that I have a master's in public health. I work in the public health space because I work for the government's Ministry of Health. And then I also am running a fellowship program in public health and community medicine. So to be a public health physician, you have to first be a doctor, and then you specialize in an area of public health. So of course, there are a lot of people that practice public health, but they are not physicians. They are not public health physicians. They are practitioners. So there is public health nursing, there's public health dentistry, there's public health, so many things. There are biostatisticians, there are even lawyers and writers and communication experts in public health space. Yes, so I am a doctor primarily, and then I have specialized in public health.
Wow. Wow, that's excellent. Now, tell us, what is the main focus of the public health? I mean, the goal.
Now, just from what I said initially, public health is about prolonging lives, is about preventing diseases. So the goal of public health is to make people live longer, is to prevent them from being ill, to protect their health, to protect them from diseases. And that's the core of public health. And so everything we do around our work is about ensuring that people live longer. So we prevent diseases, we control diseases, you control infections. Anywhere you meet a disease, you ensure that if it hasn't started, it doesn't start. If it has started, that it doesn't continue. So in public health, we do a lot to promote health. So health promotion is very important. We don't want people to be ill. But when they are ill, we also want to do what we call the different levels of prevention. So there's primordial prevention, where you talk to people and help them to stay healthy. And then you have primary prevention, where you specifically you target certain diseases and prevent people who may possibly be at risk from having those diseases. And sometimes they have it. You want to prevent complications because you want to treat them early and ensure that they don't have complications. Sometimes you meet them at the point where there are already complications. You have to prevent disability, so you rehabilitate. So all of that is about public health. And there are systems, there's a whole lot that goes into ensuring that people and communities are healthy. And so the goal primarily is to ensure that people live longer, they lead healthy and quality lives. That's the goal of public health.
Wow, that is awesome. And I must commend you for this, for choosing this this type of career and also this profession. I must commend, because when it happens to when it comes to life, we must see it as something essential, something critical that we want to take seriously. And for someone, that's why I always, give credit and respect everybody that goes into anything that has to do with health, be it, physicians or nurses or nutritionists, anyone that falls into this, I really commend them. And I'm commending you for this too. Thank you so much. And wonderfully things you have done in the community, I must say you are excellent. Now, Dr. Vetty, there are many essential public health services. At least I know 10 of this. And one of it is investigating and diagnosing, addressing health hazard and root causes, creating and championing and implementing policies, plans, and laws. More of that. Now, I want to focus on the three core functions of public health, which are assessment, policy, development, and assurance. Can you say to us today that the three core functions of public health that I just mentioned, assessment, policy development, and assurance, are in place as they're supposed to in the country today? I mean, I want us to focus on a Nigerian, country right now, because that's where you reside, and I reside in the United States. I can categorically tell you that yes, the answer is yes in the US. But I want you to tell us, is it yes in Nigeria or no?
All right, so I'll start by saying that there are principles that underlie public health practice, and one of it is equity, social justice, efficiency, effectiveness, participation of the people, you know, affordability, accessibility, and all of these come in when we talk about public health, because we are talking people, not individuals. We are talking communities. Yes. Now, when you talk about the three major functions or core functions, you talk about assessment. What we do in assessment is about finding out what are the issues. So in assessment, you carry out research, you go to the health facilities to see what are the problems. You go to the community, you ask the people, what are the issues? What are the health needs? That's what assessment is about. You gather information, you collect statistical data, you get firsthand information or knowledge from the people. And when you get that at the point of assessment, then you move to the next point, which is trying to develop policies. And these policies and plans, they are supposed to meet these needs that you have kind of discovered. So you make a diagnosis, you investigate, you find out what the problem of the community is, and you begin to develop solutions. How can we solve this problem? And then you begin to inform the people, educate them, to tell them, this is the problem, these are the issues. You empower them to know what the problem is. Then you develop policies, you let them know how these policies will be implemented, so to speak. Now, when we come down to our country, Nigeria, which is the focus of what we're talking about, our challenge may not be so much of what the problem is. Our challenge is not even in the policy, because we develop beautiful policies. Our challenge is the last bit of it, which is the assurance. Because under assurance, that is where you link the people to the needed services. That is where you look at whether the core principles are being practiced. Are people able to access help? Are they able to, to afford it? Are they able to get, even if they go to the facilities, for instance, are they able to get quality for what they are paying for? Or are there laws, and are these laws being regulated, or are they being enforced? More like, are the regulations that we put in place, the policies, are we following them? And those are areas where, as a country, I think we have some challenges. So, like I said, the first one we are able to do, even if we don't fund research so much, but we are able to find out our key issues and the basic problems. We are able also to find solution, what it is, put them in beautiful papers as policies. But when it comes to actual implementation, Who is doing what? How are we monitoring it? That's where we think we have a challenge. So if I take us back to the WHO, the World Health Organization, they have the building blocks of the health system. Okay, health system has to do with all the institutions and everything that you put together to bring about health. And we know that health is a state of physical, mental, and social well-being, not just the absence of disease. So you find out that health is beyond facility. It's in the communities, in the environment, it's in our finances, in the economy. Everything that we do affects our health. So we look at service delivery. There are, according to WHO, there are about 6 building blocks. Service delivery. Do we have efficient, quality service, health services being delivered? Do we have the workforce? We know what is happening with our workforce. We train people here, but because of one problem or the other, because of, will I say, dissatisfaction, or we are not able to encourage our health workforce. They go to where they are needed. They go to where they are paid better. They go to where their welfare matters. So what is happening with our health workforce? How is the distribution, even the ones that we have? The urban and rural distribution. What's happening with the different, for Nigeria, we have 3 healthcare systems. So we have the primary, the secondary, the tertiary. How is it distributed? What are we treating in our tertiary facilities? Are people going to the primary health facilities? Those are the problems. You have information. Do people know what they need to do? Are we using ICT to be able to know how to improve our health? Are we using data to make the right decision? And then you talk about medical products, vaccine. We are talking about COVID-19 vaccine. How much do we have in a country of about, over 200 million people? How many vaccines are we getting? For the population that we have, the population of the workforce, the population of the older people, before we even talk about those in between. Those are issues. Financing is an issue. We talk about the Abuja Declaration of how many years ago? We said at least 15% of the national budget should go to health. But we have been lingering around 5%, 7%, 8%. We go up, we come down. So we are not funding health. What about leadership and governance? What's happening? How are we taking decisions that will affect everyone? So these are the issues. When we talk about assurances, when we look at the building block, how are people able to assess all of these building blocks in quality health services that are safe? How are they able to access healthcare? What is our coverage? How many people access our facilities? A lot of them can't afford it. The entire world is talking about universal health coverage. The third goal, of the Sustainable Development Goals, Goal 3 is talking about good health for all. And our targets, one of the targets is universal health coverage. How many people are covered in Nigeria? The NHIS has been on ground for over 15 years. And because the law was a voluntary one, we find out that only the federal civil servants and a few others were covered. But the story is not all gloomy, right? It may not be as bad as we tend to look at it from outside. We're making some progress because what we want to achieve is improved health of the people, their level of health care, and we want to be equitable in doing that. There are those who cannot pay. We know we know the poverty index of our nation. How do we respond to the health needs of the people? Are people protected, social and financial risk protection? What is on ground? How is our efficiency? Sometimes we have the funds, but the services are not efficient because we can actually get more health for the money that we have. How are we doing it? We have the overarching corruption thing that everybody talks about. Where is accountability? So these are issues that are plaguing the country, but we are making progress. As we speak, at least we know that polio has been eradicated. It took years and years of work. We know that the COVID-19 pandemic that came, we were able to respond swiftly And I mean, we can't say we did badly or we are doing badly. The primary healthcare system is also something that the federal government has put in place to see that people are able to access healthcare where they need it. Okay, so
are the people get access to that? Because we see a
yeah,
lot of
so
people go to, for instance, to general hospitals, they were being rejected. Some are not even getting any access to any nurses. Is it not for the government provision for the people? How do they get access to it? Because I don't get it. A lot of people go to the federal, federal hospitals. They are not being attended to. So how is it? I still don't get it. You are in Nigeria.
okay, so
Maybe you
so
can tell us.
so let me try to help you get it. Let me try to help you get it. Like I said, there are issues. And that was why I brought the health systems building block so that we begin to understand. So when people go to the facility, there has to be a facility, right? So that's infrastructure. Now there's facility, you also need equipment in the facility.
That's
And
correct.
those equipment, they need people to use them, right? So
That's
you
correct.
need the health workforce.
Yes.
And when all of that is done, you also need the medicines. You
That's
need the
correct.
products, the drugs and the vaccines and all of that.
That's correct.
Now, we are at different points.
Look,
We are not yet there.
before you proceed, are you telling me that all these you mentioned are in place? I mean, the infrastructure, the doctors, the equipment, the medicine. Do we have them?
I am saying that we have, but we don't have enough. They are grossly inadequate. They are inadequate. I mean, a population of, we have a ratio of doctor people ratio of tens of thousands. It shouldn't be so. So you have your workforce working more than they should, and they are not getting the required welfare. You have people who cannot pay for health. So they think that when they go to the hospital, they have to pay so much, and they patronize traditional birth attendants for deliveries. They patronize patent medicine vendors. So sometimes they just go and say, I have a headache, I have this, give me this. Nobody does it takes a good history. Nobody does a physical examination, nor investigate. We all make diagnosis of malaria in our homes and we treat. So the system is not what it should be. But what I want us to know is that, just like I've said, we are taking care of assessment. We know the problems. We have policies that can actually speak to the problems. But our major challenge, is the assurances. So people don't have the confidence in the system. People don't trust the government. So they don't, even if government, I mean, look at the COVID-19 vaccine. People don't trust, or the COVID experience. People don't trust what the government is saying. So they stay home. They don't follow the instructions. The enforcement is a problem, but we have all the policies. So we are not yet there. Our indices are still very poor. Our maternal mortality ratio is over 814 or 17 to 100,000. But you know that where you live in the US or in the UK, when one woman dies having a child, you know all the things that happen. They have to find out what killed her and make sure that it never happens again.
That's right.
But here people die. And what are they dying from? Hemorrhage, obstructed labor, things that ordinarily, we can take care of if we take care of all the problems that come with the delays, whether it's the first stage, second, or third stage. Someone wants to go to the hospital, but the hospital is far away and you're in labor. How do you get there? The roads are bad. So those are the issues that we have.
That's true. I agree with you. If we have the infrastructure, we have doctors. I was in Nigeria. I mean, I was in Abuja a couple of days ago, and I heard in the news that the doctors are going on strike. I'm like, Jesus, doctors are going on. I've never heard that in America since I've been here. It sounds strange to me that doctors are going on strike. which country will allow that to happen? Eventually, I think it happens. Now, I think they call up the strike, something like that. But when I heard it, it turns me off. Like, what is going on in this country? And you see the the president going to another country for treatment. I still don't get it. I don't know. We have a long, long, long way. And that long way, I don't know, maybe in the next 30, 40 years to come, we will get there. I'm not sure. Because what is going on in the country today? I did what I call a street tour. Around Lagos, I saw what is going on. I made a video. I was like, seriously, do you think COVID is in this country? I don't think so. I almost suffocated under the, face mask because of the heat. I mean, the sunlight. I was like, I don't think this is here. And when I look at the way people behave around this crisis, it made me believe that there's nothing like COVID in Nigeria. The way, even from the top, because I went to Villa, I saw what is going on there. I kind of, like you said, that people don't trust the government. This is one of the reasons why they won't trust the government. But let's just leave that one aside, because we all know what is going on in Nigeria. Both young and old will know what is going on in Nigeria. We don't want to deceive ourselves. Now, let's go individually now. I heard about an association of which you are the president, and that is, I mean, the Medical Women Association of Nigeria, being the president of the. What is it all about? Can you tell us what you focus on, the service you give, you provide to the public? Can you tell us?
Thank you very much. The Medical Women's Association of Nigeria is an organization of female doctors and dentists registered by the Medical and Dental Council in Nigeria. Now, we are affiliated to the Nigeria Medical Association. We are also affiliated to the Medical Women's International Association, an organization that is over 100 years old now. I mean, 2019, we're in New York to have our centenary celebration. As an organization, our focus is on ensuring that we have healthy women and children. So our focus primarily is to make sure that our women and our children are healthy. And we have not left the men out. We know that when you reach out to a woman, she ensures that her husband, her children, everyone around her is carried along. So women are easily the entry point. They are the ones that access health facilities. They are the ones that easily come out to receive information. And so they are a good entry point to make a change in our communities or in our society. Right. Now, the association is 42 years old in Nigeria, and we have a national president currently based in Delta State, and we also have the association in all the states of the Federation, including the Federal Capital Territory. Now, so every 2 years, we elect a sector of executive, and they have like a strategic plan for what they want to achieve in those 2 years. Mm-hmm. So in the last 2 years, our focus has been on improving maternal and child health. And we've done that with a few strategies. One of them is to have what we call male involvement in maternal and child health. So we have men, and we approach men and confer on them champion status, so to speak, or ambassador status, because they are supporting the cause of women. They have supported either financially, they have supported by bringing men to a round table to have discussions, because we find out that a lot of women depend on their men to take certain decisions for them, and health related decisions for that matter. So if a woman is pregnant, the husband needs to be in agreement with her that they go and register that pregnancy and have antenatal care. You know, the man decides how much it's going for what, whether there is health care in the family, who eats what. You know, so when the men are interested, when the men are aware of the issues that women are going through, it's easier to break even. So that's just one strategy. We also, just as we talked about assessment, we also discovered that we're still having cases of neonatal tetanus and tetanus. I mean, by this time with vaccines available, tetanus should be a thing of the past. And so we decided that perhaps we should start ensuring that girls start vaccination, because most of the time our women are only vaccinated when they present themselves for antenatal, and then the next time they are pregnant. But there is a 5 or 6 course vaccination to prevent tetanus for life, you know. So we started vaccinating schoolgirls with the tetanus TD vaccine. Okay, we are also working on breast and cervical cancer. Good. So we have like campaigns, you know, because we know that breast cancer is common, and increasingly younger women are having breast cancer. Before now, it used to be much older women, but because of the environmental factors, because of maybe the food we're eating or whatever, you know, we are facing, the age has dropped. So the campaign is out there that women must know how to examine their breast self-examination. And then you go on to clinical breast examination and a scan or a mammo. These are things that women need to do at certain ages. You need to go for annual screening. You need to know your blood pressure. So we carry out outreaches. And these are things that are done at the state level.
Okay.
And so if every state is doing something, you know, it works together and ensures that as a nation, you know, we have a bit of everything. So our motto is healing with the love of a mother. And so our heart is open as mothers, and we reach out based on the health need that we have found in our local branch. What is the key issue? We carry out advocacy. We help the policymakers to fine-tune policies, and we also provide services.
Okay. Okay, Dr. Vet, I want to ask this question. You said that you carry out outreach to, you know, to educate, to, you know, advise people on health. Is it within the medical, you know, physician around you, all the women that are medical officers, or you, to everybody, is to all women?
So medical women, we are actually volunteers. So it's what we do is a volunteerism. So we go out to rural communities. Some of these people, the only time they assess health is when we take outreach to their community. Even if the health center is with them, they are not going there. So we go there, we screen them at that time, and we encourage them to utilize the facilities that are close by. And we have this initiative, we adopt a health facility in each state, where we carry out everything we do to see whether we can improve utilization of the facilities and improve the indices of maternal and child health, you know, services. So for River State, where I am, we have a primary health facility that we support, and we ensure that we do community engagement. We mobilize women to assess the facility. We ensure that the healthcare providers, they are trained to do every basic thing that needs to be done when women come to deliver and all of that. And sometimes we fund. So there are women who are not registering for antenatal in the facility because they cannot pay. We fund. Okay. You know, if that is their primary problem, we make sure that we fund the antenatal and we fund the delivery. And that brings us to the fact that there is need. We have been campaigning for health insurance, because it's important that everyone has a prepayment mechanism, not pay for health at the point of need. It's catastrophic. It causes people to go into poverty.
Dr. Red, this one question just came into my WhatsApp now. They want to know, this your association, is it governmental or is just a private one?
It's a non-governmental. Okay. Yes, it's a voluntary organization, non-governmental.
Your question just answer if you send me question on my WhatsApp. So it is non-governmental. Do you have it in all states or it's just Imo State?
We have it in all states.
Okay.
All states, including the Federal Capital Territory.
Okay, all right. Now, let me quickly read to you because of our time, all the messages that are coming on YouTube. I have to let you get there. We have our brother Ademola Henry say, welcome on the program. Mrs. or Mr. Vincent Agala, welcome Dr. Agala is saying welcome to you. And Mark say, well done, Mark. Mrs. Titilayo Bigi said, happy Sunday to everyone. And he said, welcome Dr. Agala on the program. Mrs. Emily Omoigbirai, they're all from United. This woman the two women I just mentioned, they are from US. They say happy Sunday and thank you, Dr. Agala, for coming on the program, blessing us with this information. And Mr. Adegoke Adekunle Adegoke say, welcome, Dr. Agala, on the program. Ebere says, happy Sunday to everyone. Dr. Ojubanja from South Africa says that, thank you so much, Dr. Agala, for this well-articulated explanation. Mr. Tolu Ayoride from US says, happy Sunday to you, to me. And Mr. UTech Entertainment says, this is a great cause to humanity. Together we are enhancing humanity. Kudos to you. These are the messages we are getting from YouTube, and they all say you're welcome. Now, let's go to the government now. Since you work for the government, let's look at it in this way. How can an average family achieve healthy living in an overpopulated environment?
Okay, so when you say overpopulated, I have Nigeria in my head. Like, okay, we are so many and our health issues are so many.
Yes.
Now, so most times people have problems, they die prematurely because they lack access to healthcare, or they don't have the time, or they don't care. You know, they think that they are strong enough. So it puts the responsibility not just on government, but on individuals, on families, on communities to ensure that people are healthy. Because partnerships and collaborations, community participation, community involvement is so important if we must achieve public health. Now, so as a family in a country like Nigeria, how do we ensure that we stay healthy? So I would start with things that we can do as individual family members, as individuals. And those are things you talk about all the time. As simple as having a good health-seeking behavior, meaning that you don't have to really wait to be sick before you access healthcare, okay? And that's one. And that's something we should learn to do regularly. Visit the dentist twice a year. Know your blood pressure. I mean, for adults, take your children for checkup and all of that. But beyond that, as an individual, what you eat. I mean, I saw the adverts and the program before now, of course. What you eat matters so much. So yes, we may be in an overcrowded place. We may be in a country where everyone is poor, but we have staple foods. We have fruits and vegetables that we can access that are not so expensive, so we can eat right. We can do little things like exercising. It's just a deliberate thing. You know, exercising, eating right, resting when you need to, and sleeping. You know, these days we are working, and work is not equivalent to productivity. You know, people are putting in so much, yet the results are not as much. It's time to take a break, to take stock, to see how to improve on ourselves. And I know when you talk about overcrowding, you're looking at housing. A lot of people are living in places where they don't even have good water supply. They don't have there's overcrowding. There are diseases that go with overcrowding. There are diseases that go with a dirty environment. You know, so we can start by keeping our environment clean. We can start by ensuring that ditches around are cleared, because that's where mosquito is still malaria is still killing people, you know. So we can keep our environment clean. we can eat right, we can wear the right clothing that protect us from the elements. We can do things that make us happy, that we are passionate about. So it's not about just looking for money. It's about doing things that give you satisfaction, or that improve your health, that improve your well-being.
Yes, that make you live well in all the areas of life. That's it.
Yes.
Thank you so much, Dr. Agala. I'm so sorry we had to go. It is a lot of information you are giving to us. I'm still going to bring you back on the program. Don't worry. I'll get you back on the program, because you are giving us vital information that we all need, especially women. I need to set up a program that you are going to talk to just women alone, because we need it and we need you on the program. So I want to say thank you so much, Dr. Agala, for coming to educate us today. And I appreciate you so much for joining us, for joining this esteemed initiative. It's been a pleasure having you on the program today. God bless you. And I want to say thank you for coming again. I'll see you next time. Thank you so much. Bye.
Thank you. Thank you, everyone. Bye.
Bye. Wow, because of our time, we can't do more than this with our guests. And I'm sure you all enjoy today's program, especially coming from the right source when it comes to our community, our society at large. So right now is our nutrition segment. I know you want to get some information from for this segment, and I'm going to run quickly because of our time on this segment. Right now, let's talk. We were taught on Health Corner what infectious disease it's all about. So let's talk about natural herbal treatment for various illness, including viral infection. So you want to make sure that you are eating oregano. Oregano, you can get it as a seasonal, like your Maggi, your curry, your thyme. That you have to get. Oregano is right here. I think you can all see it. So get oregano as a seasoner. It's very powerful. It's a popular herb in the mint family, and it's very medicinal. It reduces the activities of your norovirus within 15 minutes of exposure to that. So please get oregano. Oregano, it exhibits antiviral activities against herpes, diarrhea, and respiratory infections. Get that. You also want to look for basil. Basil, it also can be used like your thyme. You put it in your food. It's very good. You can sprinkle it in your salad. It's good. Your garlic, you've been eating garlic. It's very powerful against influenza A and B, HIV, viral pneumonia, and rhinovirus, which we call common cold. Get garlic. Garlic is very good. Your ginger as well. You want to go for your ginger. You can blend it, save it in a glass container, and take it every morning, or blend it with your pepper to make your sauce. You're good to go. So get your ginger. Also, you want to go for parsley. This is what we call parsley. Go to the store where you buy your seasoning for your meat, for your food. Get it there. It's very good. This is all that I eat. Turmeric, it's also good for you. You can't miss it. It's one of the things we have been taking when we are facing this COVID-19. You want to go for turmeric. Ignition is one of the most popularly used ingredients in herbal medicine due to its impressive health promoting property. It fights viral infections like herpes and influenza and boosts immune system. Echinacea, you get to the store, supplement store, get it, the pill. So you can be taking it every day. Very good. Now let's talk about the foods that fight infections. You want to eat cabbage. I mentioned to Mary, you want to eat yogurt. Yogurt is good for your guts. I told you last couple of programs ago. So you want to eat yogurt. You want to have your honey for your tea. You want to eat coconut and the coconut oil. You want to take lemon. Onion is good. Pineapple, olive oil, all these food are the food that fight infections. Eat them regularly. And other effective foods are fermented food like ogi, pap. Take it in the morning. It's considered fermented food. So you want to take your pap and maybe with your beans or beans cake, akara is good. So you want to eat carrot, berries, fatty fish, where you're going to get your omega-3, which is going to give you fatty acid. Tomato is there, nuts. Eat nut, peanut, almond nut, any nut is good for you to go. You also get fatty acid from nut. Now, the bottom line for all these that I've been saying because of our time, you see that herbs that I've mentioned, oregano, parsley, basil, all those things, they have been used as natural remedies since ancient times. Let us go back there. Let's get all these herbs back in our food storage. You know, these common kitchen herbs, such as this I just mentioned, they have a powerful antiviral effect against numerous viruses that cause infection in humans. Please get them from the store. Eat them regularly. It is easy to add these powerful herbs to your diet by using them in your favorite recipe or making them into tea. I hope we impact someone today. I hate to let you go. You also hate to let me go, but there's nothing we can do. That is all we can give on wellness today. I wish you all good health. Once again, thank you all for joining us and staying with us on Healthy Living with Bofa. God bless you all. I'm Betsy Olayinka Folarin Akinlosotu. I want to say thank you to all our viewers, our supporters. I want you to share this program. We have a bunch of people who need to hear this. It is very important. We share it to save lives. All this food we've been mentioning on this program, like I tell you all the time, you want to eat healthy food. It is not about taking food and be eating it. It's about looking for the one that will give you what your body desires to fight all these radicals in your body system. It's very important. And not all these health conditions that require procedure or medication. Some of you need to work on your diet, on what you put into this mouth, and you'll see yourself living beautifully well in the world today. So I hate leaving you, and I want to say thank you so much once again for being part of this program. Stay safe, stay healthy, and stick with BOFA, Healthy Living with BOFA. Wow. I'll see you next week by God's grace. It is me, Betsy Olayinka Folarin, reaching out to you today, and I say good night to everyone. Bye.